Good morning, everyone. Thank you for joining me today. Today, I'll be presenting my analysis of USA influenza data and its significance for medical staffing agency. I begin by briefly introducing medical staffing agency and the crucial role they play in supporting healthcare facilities during the influenza season. The medical staffing agency is dedicated to provide skilled healthcare professionals to hospitals and clinics during critical periods, such as the influenza season. I understand the challenges faced by healthcare facilities in managing the surge of flu patients with their existing staff. During the influenza season, hospitals and clinics often face overwhelming numbers of flu patients, which strain their existing staff resources. The timely and effective care of patients becomes a significant challenge due to the increased workload and limited staff availability. The objective of my analysis is to determine when and how many staff members to send to each healthcare facility to ensure effective patient care during the influenza season. By understanding the patterns and trends in USA influenza data, I aim to optimizing staffing levels and improve patient outcomes. As a part of my analysis, I formulated a hypothesis to explore the impact of age on influenza-related deaths. My hypothesis suggests that people aged 65 years and above have a higher probability of dying due to influenza compared to people under 65 years. Before delving into the analysis, I want to point out the vulnerable population who are at high risk of flu complication and require specialized attention. This population include elderly individuals who are 65 years and above, young children, pregnant women, individuals with underlying health condition, for example, asthma, diabetes, and heart disease. Move on to this map. This map provides a geographical perspective on the impact of influenza on the elderly population across different states. As you see, the map has different size bubbles. The big bubbles show higher death rate and small bubble shows low death rate per state for individual aged 65 years and above between 2009 and 2017. Using bubble markers, as you can see, the state with big bubble is Illinois, and it means that Illinois state has highest death rate age 65 and above of rate of 0.01378, while one of the lowest state with low death rate over age 65 years population between 2009 to 2017 is New Mexico with a death rate of 0.00071. So move on to finger 2. Finger 2 is a visualization. It's a line. It's a visualization line trend graph that shows death rate for both the 65 years age group and the under 65 years age group over the analyzed period. By comparing the trends, you can observe the significant differences in influenza-related death between the two age groups. As you can see, this blue line color represents death rate for individuals aged 65 years and above. And it's very noticeable higher than the orange line color, which is below, that shows the death rate for those under 65 years. And also you can see the number of death rate for individuals age 65 above decreased between 2010 to 2014, but 2016 started increased. Move to figure 3, which is a bar chart, and it is displaying the top 5 states with the highest rate in this, with highest death rate over 65 years and above between 2009 to 2017. As you can see, this chart provides a clear comparison of severe of influenza-related death in this state. This is allowing to identify areas that require special attention and resources allocation. The state with the highest death rate over 65 years group is Illinois with rate of 0.013777, followed by Nebraska rate 0.010568, Alaska rate 0.008116, Georgia rate 0.005899, and Missouri with rate 0.005589. So move to the final visualization, which is a stack bar chart that compares influenza mortality rate across different age groups. This chart, it helps to understand the relative impact of influenza on different age cohorts and provides insight into the vulnerability of each group. This chart displays the percentage distribution of influenza-related deaths within age group. As you can see, the death rate for individuals over 65 years and above is constantly higher than the death rate for individuals under 65 years, all years. For example, in 2009, the death rate of individuals over 65 and above was higher with rate of 0.002574, where the death rate for individuals under 65 that year was lower with rate of 0.000302. Similarly, in 2017, the death rate for individuals over 65 and above was higher with rate of 0.002617, while the death rate for individuals under 65 was low with rate of 0.000529. So move to the conclusion. The analysis of USA influenza data has provided valuable insight for our medical staffing agency and healthcare facilities. By understanding the patterns and trends of influenza case and death rates, we can optimize staffing levels, allocating resources effectively, and also improving patient care during the influenza season. Moving forward, I will continue to refine our analysis methodologies and collaborate with healthcare facilities to ensure the best possible outcomes for patients. So this is end of my presentation, but questions, comments, and clarification are welcome. Thank you so much.